So the next question is, what tests do they use for MRD and how do they work? And which test is best for the patient? So there are various ways to measuring residual disease. These include flow cytometry, which requires cells that are obtained freshly, that are collected and preserved appropriately and tested within a short period of time. Flow cytometry detects the expression of certain proteins on the leukemic cells and compares those patterns of expression to those of normal progenitor cells that we all carry in our bone marrows. So it has built within it a level of sensitivity, but also it carries within it a requirement that the person interpreting flow cytometry knows very well how that test should be interpreted and has enough experience to do that. The molecular tools to study minimal residual disease or measurable residual disease include PCR testing, which is the standard test that's been used for many years, predominantly in Europe. It is a robust test for MRD assessment that can detect cells, leukemic cells, in the tune of 1 in 100,000 to 1 in a million normal cells. This relies on tools that allow us to look for cells expressing certain molecular markers that we know were present in the leukemia at the outset. So there's a need typically to compare the original leukemia to the follow-up sample to answer whether MRD is present or not. There are newer technologies that are also molecularly based that rely on a technology called next generation sequencing, or NGS. These are really opening a new window in the era of MRD testing, allowing us to get to a much deeper level in terms of sensitivity, allowing us to detect leukemic cells in the tune of 1 million normal cells or sometimes 10 million normal cells if possible. NGS-based MRD testing is an evolving tool, so be on the lookout and make sure that you discuss all these options with your oncologist.